Hello everyone and welcome to the PHS quarterly staff meeting. I'd like to start us off today by talking through a few initiatives and accomplishments that are worthy of celebration. In Covington, our team has just undergone and passed with flying colors their accreditation survey with CHAPS. In fact, I'm pretty sure the team ended up with only one finding for the extended survey. So that is phenomenal, and my thanks and congratulations to that team. In Texas, I'd like to congratulate Tammy Guidry on her recent promotion to branch manager of our Texas operations, and as well to highlight an opportunity that the team in Texas has to present to Texas Children's Hospital. It's a fantastic way that we'll be able to spend time with new people at the hospital and to continue to build that very important relationship. And in Milwaukee, we are excited to have launched a very well-received and much anticipated Billy Light program that will allow us to serve more babies and help the communities in Wisconsin. As well, we just received glowing feedback from Robin, who's head of case management of Children's of Wisconsin. So thankful both for our quality of service and our level of engagement with the hospital. Nice work, everyone. And then here in Minneapolis, we had the opportunity to highlight our home care nurses and our home care nursing services. Our nurse, Nancy, one of our home care nurses, was recently featured on a local news story that wanted to capture the very skilled work that Nancy and our nurses just like her do every day, and the phenomenal training that PHS has available through our simulation lab. The story, if you haven't seen it, talks about the training that Nancy had here at the PHS Simulation Lab and how that training helped her to intervene at just the right time in just the right way to save one of the babies in our care from a potentially life-threatening event. Like I said, it's a great story. If you haven't seen it, I encourage you to go look it up. So many reasons for celebration, and there will be many more. And one more before we continue on to our staff meeting is to celebrate that we're extending and expanding the PHS family again with the recent acquisition of Alliance Medical Supply in San Antonio, Texas. Like us, Alliance provides medical equipment and enteral therapy to children with medical complexities. Like us, they have a committed and talented team that also practices our same mission. And together, we'll be able to expand our Pediatric Center of Excellence and serve even more children throughout Texas. So, great congratulations to everyone. My sincere gratitude for the phenomenal work that you continue to do every day. And with that, we'll continue on with the staff meeting. Grab a snack, and here comes Joe Dietlein.
Thanks, Cameo. Hi, PHS peeps. I'm Joe Dietlein. I have the pleasure of being the Chief Strategy Officer for PHS. I get the opportunity to talk to you about growth today. I wanted to first talk about the acquisition process that we have here at PHS. It's the area that I get the most questions about. Who are we talking to? When are we going to have another acquisition? How many in the next year? How quick are they going to come? When are we going to Hawaii? These are questions that I get all the time. I wanted to just emphasize the process. It is the same as it has been since the beginning of, or before COVID, but a lot of it is happening over the phone at this point, as you can imagine. We have 5 phases. We are constantly talking to companies that we think meet our target criteria. As soon as we find a group that we want to move forward with and who wants to be part of the PHS family, we enter into a period of exclusivity through a contract called an LOI, or a letter of intent. That allows us to do due diligence, which is a pretty big effort, but it goes pretty quickly. It allows us to do what I call trust but verify. So looking into everything that the ownership has told us, but making sure it adds up, checking all of their financials, their operational details, and making sure that it lines up with what we expected. When we get through due diligence, we move into the sign to close period. So being a regulated industry and having payers and states that we have have to work with. There's a lot of requirements for us to notify people when we are changing ownership of a company. So during that sign to close period, we take care of a lot of those things, and then we also plan for integration. Integration is 2 phases. There's the 100-day plan, where we really hit the ground running and make sure that we start correctly with the new organization. And then we move into a longer-term integration and sustainment phase that actually Lisa Jensen will talk a little bit more about later in the meeting. So specifically, what's in this pipeline? What's in this process? So those first 2 phases that I talked about, those are top secret. I can't tell you about those. But Cameo earlier talked about an exciting announcement that we made within the last couple of weeks about Alliance joining the PHS family. Alliance is a company that's located in San Antonio, Texas. There's about 30 employees that'll be joining the PHS family. Alliance is focused on medically complex children, just like PHS. And they are going to be a perfect fit with the rest of our Texas operation, as well as the rest of the PHS family. We're targeting the end of August to have a close on the Alliance transaction, and then we'll officially celebrate a little bit more, and we'll unveil the Alliance co-brand, where we start to incorporate the PHS brand into the Alliance brand. In the integration phase, we have the care group and RSVP and pulmonary partners. They are well into being integrated as part of the PHS family, and you guys, well, you are part of the PHS family. We just call you Covington, Houston, and Dallas at this point. Acquisition is not our only path to growth. We also grow via organic growth. So that's expanding services, increasing our geographic coverage, and taking care of more children with medical complexity. In Texas, one of the ways that we're going to grow in the near future is by adding infusion pharmacy. We're excited to announce that Q1 '21 will be including infusion pharmacy and infusion nursing in all of our Texas locations. Also, we're always increasing our payer relationships. However, one exciting development on the payer front is in Indiana. So our Covington office serves kiddos coming out of Cincinnati Children's, and those kids discharge into Indiana. To date, we've not been an Indiana Medicaid provider. However, we are now. So that sets us up with the opportunity to serve kiddos that are covered specifically by Indiana Medicaid, as well as contracting with MCOs that participate in the Indiana Medicaid program. I think that's pretty exciting. We have lots of other things going on in the growth world, and I look forward to telling you more about them over time. But right now, that's the news that's fit for print. I'm going to give it back to Cameo. Thanks a lot for your time, and enjoy the rest of the meeting.
While we are still in the summer of 2020, work is well underway for business planning in 2021. So what exactly is business planning work? In business planning, your senior team, alongside your entire leadership team, develops a detailed one-year plan that describes the goals we want to achieve, the resources necessary to achieve them, and how we'll know if we've achieved them and achieved them well. Those goals include executing on growth opportunities, meeting our budget targets, and completing initiatives that support our growth and support our mission. To do that, we need to invest in resources. Resources in time, resources in people, resources in systems and products and services. And then we need to figure out what are the outputs. How will we know that we've achieved those goals? So the outputs are kind of a yes or no. We did it or we didn't. And some we want to layer in outcomes. What are those measures that will tell us not only that we achieved the goal, but how well we were able to achieve it? So for the fiscal year 2021, which has now converted from October through September to January through December, you will see a result of a detailed plan that includes all of that information, and that you will hear from us throughout the year what our progress looks like, and again, those accomplishments that we can celebrate. Beginning this year, our 2021 business plan is supported by a 5-year look-forward plan. Of course, it's in less detail than what we'll look at for 2021, but it sets a roadmap. It allows us to prioritize the many opportunities that are ahead of us so we can continue to plan for our growth as we continue to serve more children and families. For timing and expectations, the executive team is already underway with this work. We will be doing an off-site and virtual planning session through August, for a couple days in August. That will be supplemented by, of course, work in collaboration with our site general managers to occur in October. And then from that collaboration, we will be presenting a draft budget and plan during our monthly performance indicators meeting within Tandem in October, and then finalizing that work to be presented for approval to our board of directors in November. Of course, you'll see iterations of that as we go, and I commit to you that we will be very excited to share with you, again, that finalized plan so we can all work together in alignment towards our goals. And with that, I'd love to turn it over to Lisa Jensen to provide you with updates on integration.
Thanks, Cameo. I'm really excited to be here today to share some integration updates with the entire organization. There's a lot that has been going on over the past months, and I think for me it's really hard to even remember Kentucky and Texas not being a part of the PHS family, but for those of you that are counting, our Texas family has been with us for 253 days, and our Covington family has been a part of the PHS organization for 193 days, and in that short amount of time we've really accomplished a lot, and I think like any growing family we've certainly experienced some challenges over the past few months, as well as had an opportunity to celebrate a lot of successes. I think the COVID-19 pandemic, along with the death of George Floyd and the civil unrest that followed that, really highlighted the importance of working together as a family, and I think this organization truly has exemplified what better together truly means with that. So I'm going to just give you an overview of some integration activities that have been happening over the past few months. The list is certainly not all-inclusive, but it really does represent a lot of hard work that has been done by this entire organization. So some of the things to highlight: our billing department is now utilizing the same metrics that they're reporting for our key performance indicators. Our respiratory team is meeting on a regular basis to kind of talk through what those best clinical practices are for taking care of our kiddos, just to ensure that the care that we're providing for them is truly the best care possible. Our compliance department has implemented the Lighthouse platform. They are also in the process of reviewing all of their detailed policies and procedures, which are so critical to our organization. And as we look to the future, one of our key initiatives is to have a centralized PHS brand, and part of this process is for PHS to all be accredited by a single agency with that. So we're excited to kick off the process to prepare for all sites to be Joint Commission accredited in 2021. We've got subject matter experts that are in the process of reviewing our patient education material. They've reviewed well over 100 documents so far, just to identify the alignment of those education documents. We're busy planning some major construction projects for Covington, Houston, as well as Dallas, and these are all going to allow these sites to continue to grow. Finance has migrated all of our sites over to NetSuite, which has created a single platform for our finance reporting. We've established a length of service award, as well as the culture champion throughout each of the offices in the entire organization. IT has implemented our Office 365, and we're extremely close to completing the integration of Houston, Dallas, and Covington into one Brightree instance, which really it sets the stage for additional opportunities related to the management of our EHR. Our marketing department has launched multiple campaigns signs introducing PHS to all of our geographical locations, and they're busy working on additional projects that will continue to bring recognition to the PHS brand. Our staff has been involved with countless meetings over the past few months related to integration. This has really just given us a really nice opportunity to get to know each other. And an interesting fact, Rick Silverman used to be a singing telegram guy, so Rick, pretty sure we can find use for that skill set somewhere in the organization, so more to come on that. And as I said earlier, this list is by no means all-inclusive, and I think it's especially impressive given the fact that everything that we've done has, we've had to do it virtually due to our inability to travel. We've learned a lot about integration, and we're continuing to add new tools and new resources just to streamline the process. And I personally want to thank each and every one of you for just your positive attitude and your dedication, because without that, there's no way we would have been able to accomplish everything that we've been able to get through so far. So thank you so much. And now I will hand it off to Roy.
I want to take this opportunity to thank everyone here in Minnesota, as well as in Texas, Kentucky, and Wisconsin for their cooperation during these unprecedented times. The COVID pandemic has changed our lives and will continue to do so in the immediate future. CDC and State Department of Health guidelines are a moving target. As we learn more about the COVID virus, these guidelines are constantly changing. Please be patient as we try to keep up with the changes in our pandemic policy. These updates are discussed with members from all of the PHS branches at the COVID conference call, which is held every 2 weeks. I want to encourage everyone to continue to follow CDC and their own state guidelines regarding COVID. There will continue to be sporadic outbreaks of disease across many states. The best way to control this disease has been demonstrated. Social distancing, wearing masks, good hand hygiene, and avoiding crowds. Avoid high-risk exposures. If you think you've had a high-risk exposure or you have COVID symptoms, do not report to work till safe to do so. If you think you are eligible for testing based on symptoms or a high-risk exposure, contact your healthcare provider to see if you can be tested. Part of staying healthy includes mental health. Find safe activities that will minimize your risk for an exposure. Others may need to pursue mental health resources to help cope with the isolation imposed on us by the pandemic. For those of you starting young families, the latest news is very encouraging. The American Academy of Pediatrics, of which I am a member, has released guidelines for new mothers that test positive at the delivery of their newborn. It is safe for newborns to room in and mothers to breastfeed as long as they practice the recommended care guidelines. I'm optimistic about the future. I think there's a good chance targeted therapies for both prophylaxis and treatment will be developed to combat coronavirus. The rapidity with which vaccines are being developed and going into phase 3 trials is amazing and unprecedented, and hopefully will come to fruition. There are concerns about this upcoming influenza season. We know very little about outcomes of co-infection with influenza and coronavirus. In winter, there's a greater likelihood of congregating indoors and increasing the risk of transmitting respiratory viral diseases. I am encouraging everyone to seek vaccination against influenza this fall. Thank you for your time. Be patient, vigilant with our guidelines, and may you and your family stay well. If you have further concerns, address them with your manager, and they will be brought forward to the COVID committee. And now I'm going to turn things over to Todd to discuss back to work.
Hi, I'm Todd Erickson, the Chief Human Resource Officer. delivering the latest update on our return to work topic. The big announcement that I want everyone to hear is that we will be postponing our return to the office date from September 8th to January 2nd. Now, obviously, if the situation drastically changes and improves, we will entertain an earlier date. And rest assured that if we do, we will plan and communicate well in advance so people have an opportunity to prepare for that. We are seeing a growing number of employers postponing that date, and many of them are choosing the new year to restart. In fact, we're seeing quite a number of employers push that date well out into the summer of 2021. It's primarily due to the fact that many of the COVID cases are increasing in almost every state and nationally overall. And of course, the other motive is that as employers, we want to ensure that you're safe and you're healthy. It still makes probably the best sense for us that if you can work from home and be productive and effective, that is the safest plan. We fully recognize that working from home can be a very difficult challenge for many. And actually, I heard recently that phrase should be changed. Not working from home, but more like living at work. And we do understand that many people with children have that dual responsibility of trying to be productive at home while at the same time trying to occupy their kids' time. And that's only going to increase as school starts because many of you will be responsible for facilitating a lot of their schooling. Yeah, with the prospect of this pandemic continuing for the next unforeseeable number of months, we're certainly looking for ways where we can ease some of that burden, but we really are encouraging you, reach out to us, tell us what your challenges are, and that will help us address some of the needs that you might have. In addition, I just wanted to remind everyone that we have some great self-care resources. If you haven't been out to the hub yet, I encourage you to go out and explore. In fact, if you look at the top, there's a link called COVID-19. If you click that link and then look for and select the benefits tile, you'll see all of the different lists of the self-care resources that we have available for you. Lastly, I just wanted to make the announcement that we'll be starting a new series of virtual events, hopefully to keep us connected and infuse a little fun into our day. So stay tuned for those announcements coming your way. And then just kind of back to that return to work topic. I know that many of you have questions, and it is likely that when we do reopen, that we'll be doing that in a phased approach. So not everyone will be coming back at the same time. We'll be designating certain groups to be staggered over a period of time to come back to the office. And then I'm guessing that in many cases, teams are going to take a little different approach as well, where you may have different platoons of staff being scheduled on alternate shifts or potentially coming in at different shift times. We'll also have cubicle spacing that's appropriate to keep and enhance your safety. We'll be limiting some of the rooms and areas for the number of people that can be there. We'll have additional cleaning schedule and we'll have specific disinfecting process if we need to apply that. And then of course, just the normal precautions that all of us have grown accustomed to, like self-monitoring for symptoms, social distancing, wearing a mask. All of those things are still going to apply and will certainly be incorporated in our returning to work. So with that, I will say stay healthy and be safe. And I'll turn it over to Cameo.
We know that at PHS, our culture is the key ingredient to our Pediatric Center of Excellence. So I'd like to take a few minutes at each staff meeting to talk about that, to continue to nurture that culture. And what that means for your August staff meeting is a teaser to our Employee Appreciation Week, which is scheduled to occur the week of September 14th through the 18th. For those of you who have been with us for a while, you know that this is an annual event, a time we take to celebrate you, and a time we take to celebrate the culture that you have helped to model, and to celebrate And thank you for the special way that you support our patients and families every day. Together, we help our patients achieve their best lives at home where we know they want to be. This year's theme is Better Together. And the idea of being better together is familiar to us at this point. We've accomplished much growth in the last year. And through that growth, we've had zero compromise to our Pediatric Center of Excellence. In fact, we have become better together. So that's the reason for this year's theme, and we believe it resonates well across our sites and with each and every one of you. This year, we'll pay special focus to our guiding principles. Those principles highlight the values that help drive how our teams show up every day. We'll have unique activities as well for each day of the week. On Monday, we will have an employee appreciation focused town hall, and there'll be a t-shirt delivery. On Tuesday, we welcome you to have coffee with a coworker. It could be Joe Dietlein any day of any week because he never stops drinking coffee. But on Tuesday, choose anyone. On Wednesday, we'll be doing guiding principle puzzles because who doesn't love a good puzzle? And Thursday, be ready to rock your PHS swag. We'll round out the week on Friday with a Guiding Principles illustration contest so you can show off your wonderful art skills. And then, of course, in true PHS fashion, you can expect these contests to come along with prizes. As we get closer to the September week, we'll provide you with additional information on how to participate, but please know that all of the activities are designed so everyone can participate in the fun, whether you're working in the office or remotely. And then finally, as I teased just a moment ago, we are offering to each of you as a token of appreciation Better Together t-shirts. They will be similar to those Minnesota, Wisconsin t-shirts we shared a couple of years ago with that same nice soft vintage feel. And the graphic will celebrate our growth as we again are better together. After this meeting, you'll receive a link for the order form where you can specify your size and fit as well as your delivery preference either to your home or to the office. Please pay close attention if you could to the ordering deadline so we can make sure everyone has their t-shirts in time for the Employee Appreciation Week. Again, that's scheduled to start September 14th. So with that, we have come to the close of our quarterly staff meeting. Thank you again for taking time with us today. I hope you found it informative and maybe even a little bit of fun. Remember to tune in on Wednesday, August 12th for the Q&A portion of the meeting. And as well, if you have comments or feedback on how we can make this time more meaningful for you, please do let us know. Thank you so much, and I'll talk to you soon.